Hi, I guess this is live. So I'm Dr. Samantha Durland, and welcome to our Facebook session today. And I'm so excited just to I feel like I'm just going to ramble a little bit today. I hope you enjoyed the video. These are the things that I wanted to talk about. So first couple things is I wanted to send a shout out for a patient that I saw earlier today. She is taking hormone therapy, and she said for Thanksgiving that she was around some other girlfriends, and they were having a lot of hot flashes and didn't feel well and were potentially just a little bit more negative. So she had to kind of step away. And I was just like, well, I'm so thankful that you're feeling well because you get to spend your energy, I'm just so thankful that you were feeling well. And so I just want to send, from her telling me that, I just wanted to send another connotation thought out that, we don't have to suffer and we don't have to feel bad. We just have to reach out and ask for help. And sometimes we get stuck in these little circles that we feel like we're just kind of stuck there, and it gets hard to see our way out. But she is out of it, and she could see how other people were in it. And anyway, I just wanted to say that. And number two, okay, so over Thanksgiving, I've got a 15-year-old, an 18-year-old, and a loving spouse, and they're all boys. So a lot of times over the Thanksgiving holiday, what I'll do is I'll do my board certification for the American College of OBGYN, which literally I sit in front of a computer for several days and answer a lot of questions and read a lot of articles. But the one that really made me took pause had to do with gonorrhea and chlamydia, and the fact that I should actually screen our rectum to actually help pick up 20% of that I wouldn't know otherwise. And that made me took pause. And I said that to hopefully capture your attention so you listen to the next thing, because it really did capture my attention. So, okay. So one of the things I was going to just briefly touch upon is one of the last questions that people had asked was about thyroid dysfunction. And so today I was just going to touch a little about migraines. And so one of the things I really love to do for migraine headaches, if the patient seems like this is the actual cause of that, is I love to use neurotoxin or Botox or Juvo or whatever thing that we have in place. And so let me explain how that is. And so migraine headaches, if they are more like tension, or if you feel like they start here and go up, a lot of times if you're injury and you block your like this, or if we get these headaches here or here or here, what happens is our head muscles are tiny. My bicep muscle is a little bit bigger. This muscle is tiny. So if I always am trying to contract this muscle all day long, after a while it's like, dude, I can't do it anymore, and it just aches. And so I'm doing it and I'm not knowing that I'm doing it. So if you inject a little bit of Botox or like-minded compound, it doesn't have to be Botox, and could be any of them. They all work the same. They make your muscles not contract as much, but they don't make if you inject it in your traps, it's not like they fall down and you can't like lift your purse or like lift above your head. It just makes them less tense. And if they're less tense and they can't contract as much, then they hurt less, which is awesome. So if you stay on label for neurotoxin or Botox for chronic migraine therapy, on label just means when I went to the FDA, I said everybody had to be treated the same, and I treat everybody with 155 units of Botox to their head. And so they go here, they go back here a little bit, they go here, here, here. Those are the classic places that we tend to inject. But what I find is not everyone needs 155 units. In fact, not everyone needs near that much at all. So I'd like to ask patients where they're uncomfortable, and I inject a little bit in those areas. It's very affordable, and it gives people relief of their pain. So I just wanted people to know that option is there. And that is what I like to talk about a lot with migraine therapy, is that a lot of times it's tension and we're shooting it out of our head. And if you can just kind of help relax the body and teach the body how to let it go in other ways, then headaches can get better for some people. And I just think that's super fun. And then the other thing I wanted to, a couple of other just things I wanted to mention is we're having, like this month is December, so on our Facebook community, we're talking about like thankfulness. And one of the things we're doing is we're going to try and kind of like read a book and kind of talk about like a little mini book club, if you will. And the book that we're going to read, and Lauren is so amazing that she already got this on Amazon because she is so super speedy and thorough, is we're going to read this thing about the gifts of imperfection, just to kind of let people know that nobody is perfect, although I think we think that we have to be set up to some standard, but the only standard is within us each as individual, and there is no perfection, and that's the point. So hopefully in reading this, we can just have a dialogue about that and how we all matter and how we're all important. And this just brings up points. So know that we're reading this. And then the other thing I'm super excited about is Connie, the awesome nurse practitioner that sometimes, I get to work with, and I are going on a little road trip this weekend. And we are going to Chicago, and we are going to learn about Beautiful. So what the heck is this? So Butafil is an autologous fat transfer system. So what the heck is autologous fat transfer? Autologous fat transfer is where you remove your own fat and you inject it where you want to. And historically, when they come out with these types of devices or this type of procedure, it was difficult and challenging because you get inconsistent results with the amount of fat that you inject. So if I inject this side and this side, then maybe this side will look different with that, and nobody likes that. So this particular system has overcome that challenge. And so we are going to learn how to remove fat from one area and inject it into other areas. And the other areas, for example, that we're specifically starting to talk about is in our breast and also in our face. And so the fun part about this that I'm so super excited about is, number one, it's just exciting to help people. And number two, it actually is, your fat's permanent, right? Your fat doesn't go away until I dissolve it, I suck it out, or I move it to somewhere else, okay? So if I'm gonna look at my face, or if I'm gonna look at my breast, a lot of people will say, I may wanna do a breast augmentation. And if you wanna do breast augmentation, I'm super excited for you. But if you don't wanna put a foreign body in your body, which is the breast implant, then this is a way that you suck your fat out from one area and you move it here, and you can make your breast look more plump, if you will. And so I just think that that is a nice option for people to have that, because, you know, in being able to go to Iowa and working with more patients, I definitely believe that breast implant illness can be a true entity for people. And to know that there's an alternative to having to put a foreign body in your body, that you can use your own body, move your own stress, and have great outcomes is just really nice. And the other area I'm really excited to use this is in our face. Because again, you know, we inject filler, we inject Botox in different areas of the body. But when we think about our face, you know, Botox is usually, and I use Botox as a kind of a generic for any neurotoxin. And so other names for neurotoxins would be like Juvo or Botox or Dysport or Xeomin. So they're all kind of mechanism is the same thing, even though they have some slightly different characteristics about themselves. So if I'm going to inject Botox in my face, I'm going to inject that a lot of times here up. So I'm going to relax those muscles, or I'm going to put them here on my crow's lines, or if I'm going to put it here, you know, where I get those 11s, or maybe a little lip flip, or maybe the bunny lines that I get right in here. But I don't inject Botox to make my support system of my face look more restored, because it's not going to do anything to restore that. It just makes like wrinkles go away and kind of moves my muscles a little bit sometimes. So if I'm more concerned about like wrinkles here, or if my lips are like losing volume, or a lot of times we get mid-face lack of volume, because the zygomatic arches, which are these bony structures that come down from my skull right here, and you can push on them, you can feel them underneath, those go down, because we know our bones go down as we age, like with osteoporosis, and the same entity happens with our head. So a lot of times this happens here, and then the fat pads of our cheeks tend to go down, so we start to get these little lines here, we get lines underneath our eyes, and then what happens is the skin sags, and as the skin sags, these lines get more, and then we start to get some jowls underneath as our skin kind of falls off. So what happens is, if I can suck your fat out, and if I can inject it like here, under here, what happens is your fat stays forever. So whenever you are injecting a filler in your face, it is going to break down. It's going to break down because your body breaks down. So you have to do it over and over and over and over and over and over again. And that could get a little pricey. And plus, every time you inject in your face, you can get some bruising. So it would be awesome if you have a little bit of fat in your body that you have accumulated over time that's slightly bumming you out, and you just like to have gone. I'm like, that's so easy. And then we could take it out and inject it to the areas of your body that are changing, so you feel reconnected with yourself. And I'm just so pumped to be able to go and learn, you know, kind of advancements of this, so that we can perform that in our office. And then we're even more organic, where we can really help. I feel like we've really kind of honed down on what we do to regenerate the body from the inside out, you know, about how we feel, about metabolic wellness, about hormones, about you know, sexual function. And now we're starting to really hone on how to apply that principle of using your own body to help regenerate itself to other areas, which are areas that we as women connect with ourselves too. And so we could do these in-office procedures, and you leave the same day, and you get to see some pretty quick, immediate results with minimal downtime. And that just seems super appealing to us. So we're going to make a little video about our little trip, and a lot of and what we learn, and some of the procedures that we're doing. And we look to share that with you, because we really feel like this is going to be a complementary procedure to the other things that we've learned and that we perform for people, and really just kind of sets apart that we're not trying trying to use other things to help you be your best you. We're trying to help teach you about your body. We're trying to help restore your body's natural healing potential, and that is just super hopeful feeling and super uplifting, lifting. So anyway, those are the things coming up. So again, hopefully those little tidbits about migraine headaches and options that you can do was useful. And then stay tuned for our little video that we're going to generate, which may take a week, I'm not quite sure, about our little journey to Chicago and what we learn and thoughts that we have along the way, because I think that'll be useful for a lot of people, and I think it can be super transformative for people who are considering certain things in their body, to just be able to have an option that you don't have to put a foreign body in your body. You can move yourself to where you want it, and that is empowering. So anyway, I hope you've had a great day. I hope you had a great Thanksgiving, and thanks for tuning in.